So the first disease we're going to talk about in neurology uh, is a stroke. So a stroke, by definition, is death of brain cells. There's a number of different types of strokes, locations of strokes, but let's just keep it simple first. So cerebral vascular accident, same term as stroke, is it's not just ischemia, it's infarction or hemorrhage leading to cell death, to brain cell death. Okay, so when you have a stroke, either you have an interruption of blood supply by a blockage of an artery, or by a hemorrhage of an artery. Those are the two ways that you can have a stroke. And typically, if we were to look at the cells of the brain once they've lost their blood supply, you can start to see changes within half a minute. It's amazing. They're not dead yet, but within a half a minute, because they're so highly metabolic, the brain uses so much energy, it needs its blood supply. Within 2 minutes, the metabolism of the brain has stopped, and within 5 to 6 minutes, the cell has died. So you can see that brain cells are highly reliant on arterial blood supply and the nutrients that's in them, which is oxygen and glucose, and others, but those are the two most common. So let's look at the photos, the images a bit. Ischemic stroke versus a hemorrhagic stroke. So an ischemic stroke means that the artery has become obstructed. And typically it's either from atherosclerosis and a plaque that's finally just completely clotted off the artery, or it's from an embolus. So a piece of a plaque or a blood clot that's traveled from one location, such as the heart, and traveled up the arteries into the brain and blocked an artery completely. So ischemic strokes are from thrombosed plaques or atherosclerosis, or from an embolus. A hemorrhagic stroke is just as the artery has ruptured. And often these blood vessels, we'll get into this in a bit more detail later, often these blood vessels are weak. There's something wrong with the blood vessel, or the person has had chronic hypertension. And finally an artery rupture somewhere in the body, and in this case it's the brain causing a hemorrhagic stroke. Okay, so let's again go back to the types of strokes. Ischemic stroke is where the lumen of the artery has completely been occluded, blocked, and that makes up about 80 to 85% of all strokes that come in to the hospital. So most of them are ischemic strokes. So within the ischemic strokes, meaning the patient has lost blood supply due to a blocked artery, it's either from a thrombus, so a clotted artery due to atherosclerosis typically, and we discussed atherosclerosis in the coronary arteries. Now it'll be atherosclerosis in the cerebral arteries, or an emboli. So a plaque or a blood clot has broken off from elsewhere. For example, a larger artery in your neck, such as the carotid artery, or you've thrown off a clot from the heart, such as in atrial fibrillation, and it's traveled to the brain and completely occluded a blood vessel. Hemorrhagic stroke is much smaller percentage of all strokes, about 15%, 15 to 20%. And this is from a ruptured artery. What's the most common underlying problem is chronic long-term hypertension that leads to an arterial rupture. Okay, now you can imagine that a hemorrhagic stroke they're both very sudden in terms of loss of function, But in terms of, say, like, that slide, I could probably just add a bit more information where it says sudden onset of symptoms. They both can have sudden onset of symptoms, whether they're ischemic or hemorrhagic. Definitely sudden onset of a severe headache would be a hemorrhagic stroke. And these have a very high mortality because when an artery bleeds in the head, it sometimes doesn't stop bleeding. So look at the mortality rate of 40 to 80%. One of the most common reasons, other reasons other than hypertension, so chronic hypertension, definitely a reason for having a hemorrhagic stroke. But the other common reason is you have something wrong with the arteries themselves. So you could have a small aneurysm in your brain, and about 1% of people actually walk around in the population with what's called a berry aneurysm, a small little aneurysm in one of the arteries of your brain. Hasn't ruptured yet. The patient doesn't know they have it, but it's with them, and it's developed from childhood or early adulthood into a cerebral aneurysm. And they can rupture, especially in the setting of hypertension. Okay, so let's look at this slide together. So remember, an ischemic stroke is anything that has caused a blockage of an artery, a cerebral artery, and has resulted in neuronal death, right? So cell death of neurons. Okay, so one of the most common causes of an ischemic stroke is going to be atherosclerosis, right? So you can have atherosclerosis of the cerebral arteries. You can have atherosclerosis of your coronary arteries, leading to a heart attack. You can have atherosclerosis of your peripheral arteries, say to your legs, causing peripheral arterial disease and potentially causing an ischemic limb, right? A blocked artery to a leg or sometimes an arm, but that's much less common. Okay, so atherosclerosis is really a widespread disease of all of the arteries in the body. It's not just one, it's not typically just to one organ. So if somebody has atherosclerotic disease, they have these blockages all over their body, typically. Okay, so when atherosclerosis is building up these plaques in the cerebral arteries, when it gets to a critical narrowing, or the plaque finally ruptures open and releases all the fat and cholesterol that's built up in the atherosclerotic plaque, what happens is the blood recognizes it as foreign and worsens the problem by clotting the plaque, okay? And then you get full blockage of the artery, okay? And that's what leads to a stroke. The other cause of an ischemic stroke is an embolus. So an embolus just means a clot that's traveled from somewhere else. And by far the most common cause of an embolus that's traveled to a cerebral artery and blocked that particular artery is from the heart. And why does the heart produce a clot? Typically because of atrial fibrillation. Okay, so in atrial fibrillation, your atria aren't contracting regularly. And because of the irregular contractions, blood pools in the atrium and allows it to clot. When the heart pumps, that clotted blood then embolizes and travels to a cerebral artery, leading to an ischemic stroke. Okay? So ischemic stroke from atherosclerosis or from an embolus. Okay? And that's why we treat atrial fibrillation with anticoagulants, so that we keep the blood thin enough that it cannot form clots within the chamber of the heart. Okay, and this slide's just showing you and also reminding you about the two different ways that you can get an ischemic stroke or a cerebral arterial blockage. Okay, it can be thrombotic. Well, thrombotic is the same as saying basically atherosclerosis. So the plaque ruptures, the blood clots onto the plaque because it's ruptured, leading to complete occlusion and blockage of the artery that then causes a stroke, okay, of the area where the artery was feeding. Okay, so versus an embolic stroke, where the clot has traveled typically from the heart, as I mentioned in atrial fibrillation, or say one of the larger arteries in your neck called the carotid artery. Say a piece breaks off from atherosclerosis in the carotid artery, a piece breaks off, travels up to the brain, so it embolizes to the brain, leading to an embolic stroke. Okay? So if you're thinking of the word embolus, always think of the fact that the clot has traveled from somewhere else. So when we say pulmonary embolus, we're saying that a clot has traveled, typically from your leg, and now has lodged itself within your lung. Okay, so it's the same concept. So both of these lead to ischemic strokes. There's been no hemorrhage at all. Okay. Okay, ischemic stroke. So occurs when an artery that supplies the brain is blocked. So whether this is from thrombosis, atherosclerosis, or from an embolism that's traveled from another location, such as the carotid artery in the neck, or even from the heart, you developed a clot in your heart and you embolized it to the brain. Either one of them can cause an ischemic stroke. So when we're talking about ischemic strokes, remember that ischemia is reduced blood supply to a part of the brain. Infarction is death of the tissue of the brain. So if I ever ask you what's infarction, well, that's death of the tissue of the brain. Ischemia means reduced oxygen and glucose to the brain cells. So there's a condition called transient ischemic attack, a TIA, and this is basically a temporary blockage of a small blood vessel in the brain. And it's temporary because the body is able to reverse it. So let's say that you suddenly get weakness of your left arm and your left leg, and it lasts 15 minutes, and then suddenly it goes away and you return to normal. That's very suspicious for a transient ischemic attack in your right cerebral hemisphere. So a small artery got blocked, and the body, through its anticoagulation factors, because it doesn't want the artery to be blocked, has been able to open it up and reverse it. The blood flow returns and the brain recovers and you get all your function back. That's a transient ischemic attack. Another example is suddenly you lose the vision in one eye. Suddenly, within a second, total loss of vision in your left eye. And then it returns in 5 minutes, completely back to normal. Well, that's a TIA to the retinal artery. Okay, so TIAs are basically warnings that you could get a stroke in the near future, whether it's weeks or months away. So we do investigate them. Compared to an infarction, so that's a stroke, it's permanent damage. It never returns. Okay, so when you have a stroke from the beginning and you don't have full return of function, That is not a TIA. That is a cerebrovascular accident or a stroke. Okay. So the bottom of this slide, if blood flow is restored, infarction can be prevented. So we're talking about a group of drugs, fibrinolytics, that try to, another term for clot busters. We use them in the heart to try and open up coronary arteries. So there's a number of them. TPA is one. Alteplase. They're all in the fibrinolytic group. They try to break up the clot that's there. And we use TPA, or fibrinolytic, in strokes, as long as they come in within 4.5 hours. After that, it's not been shown to be beneficial. And even before then, before the 4.5 hours, there's a question of whether they're beneficial. They're used, but the patient is given a lot of information about the risks of being given a very powerful blood thinner such as a fibrinolytic. We can actually cause significant amounts of bleeding within the brain or gastrointestinal bleeding, so they're not without risk. So why wouldn't we give a fibrinolytic to someone who already we've diagnosed with a hemorrhagic stroke? Well, they're already bleeding in the brain. A fibrinolytic is going to make them massively hemorrhage into the brain, and that would not have a good outcome. So fibrinolytics are only used in ischemic strokes. Okay, so hemorrhagic stroke. So very sudden onset of severe headache. Often these people come in and they were actually not doing anything, and they had a severe headache with vomiting, confusion, sometimes loss of consciousness. And what's happened is the blood is leaking out of an artery. They may have had chronic hypertension. They might have a small aneurysm that made the vessel wall weaker. Some of them can be traumatic. So if someone's in a major car accident and they hit their head forcefully on the window or the dashboard, that can cause the brain to hemorrhage. And a lot of them are spontaneous. You know, someone doesn't know they have an aneurysm and it finally ruptures one day. So aneurysms are just what they're dilated blood vessels, arterial vessels that are weakened. So they dilate. They get bigger and bigger over time. And the types that you can get in the brain are berry aneurysm. So berry meaning they're actually the size. They're often the size of a small blueberry or a bit bigger, and they gradually grow off the artery until it finally ruptures. An AV malformation, an arterial venous malformation. This is a congenital condition. So you're often born with this. And what it is that the vessels didn't completely separate and form arteries and veins and capillaries in between them. And so you have this whole collection of arteries and veins in a tangle of blood vessels, and they're very abnormal. They didn't develop properly, and that makes them extremely weak. So aneurysms and AV malformations are the most common arterial problem that weakens the vessel in the brain that can lead to hemorrhage. So where can these hemorrhages occur? Well, if it's within the brain itself, it's intracerebral. If it's around one of the layers of the brain, then we'll name it based on which layer is involved. And we'll come back to this. I put in brackets here, epidural hemorrhage, a subdural hemorrhage, and a subarachnoid hemorrhage. Don't memorize this now or anything. We'll come back to it. It'll make more sense. So, is it in the brain? Intracerebral. Is it outside of the brain and in one of the layers? it has a different name. Okay, the symptoms, sudden onset, and we call this a thunderclap headache. This happens within a second. So if we hear that someone has had a sudden headache within a second, they were fine before, and now headache, vomiting, confused, loss of consciousness, we will think that this person may have had a ruptured aneurysm or some kind of a hemorrhagic event in the brain. And how do we distinguish between ischemic or hemorrhagic strokes? Well, we could play the odds and say 85% are ischemic and 15% aren't. 15% are hemorrhagic. We obviously don't do that because the treatments are very different. We use a CAT scan most often because they're extremely fast. We can put someone through a CAT scan very, very fast, within minutes, or an MRI. Unfortunately, MRIs take a long time. They can take 30, 40 minutes with the person lying in there. So they're less frequently used at the beginning. So the treatment, we never give any blood thinners to someone who's had a hemorrhagic stroke. So if we see a hemorrhagic stroke on CAT scan, they will not receive aspirin or clopidogrel or a fibrinolytic, any blood thinner, because it'll make them bleed further into the brain. So treatment really is controlling the high blood pressure to a certain extent. If they're on blood thinners, we'll try and reverse those blood thinners with different medications because the blood thinners are making the bleeding worse. And often neurosurgery will be involved, will be consulted if it's a large hemorrhagic bleed in the brain or one of the layers, to see if they can remove some of the blood clot. This isn't always possible, but a consult will be neurosurgery will be consulted to see if there's any potential for removal of the blood clot or the hemorrhage in the brain. Okay, so let's look at a couple of conditions that can lead to a hemorrhagic stroke. So at the top of the slide, and we can be born with this condition called arteriovenous malformation. So during the development of the brain and the brain blood vessels, the vessels didn't form normally, okay? So some of the arteries connected prematurely to the veins, and they became very abnormal blood vessels. You can see it on the right of the slide, these really distended and engorged blood vessels, and they're prone to bleeding, right? So someone who is born with an AV malformation is predisposed to hemorrhaging, right? Because the blood vessels are very abnormal. So that's actually one of the causes of childhood strokes. But it can also happen in adults if the vessel didn't rupture until adulthood. What about a berry aneurysm? So berry aneurysms are little outpouchings of arteries that are within your brain. Okay, so they're not normal to have these little outpouchings of the artery. What happens is, with constant pressure within the artery, which is normal, constant blood pressure, the aneurysm can enlarge gradually over time and finally burst. And you suddenly have a hemorrhagic stroke. Okay, so these are two examples of where the blood vessels are abnormal, leading to a hemorrhagic stroke. Remember, hypertension is one of the most common and the biggest risk factor for developing a hemorrhagic stroke. But if you have abnormal blood vessels, such as in these two examples, That is definitely a risk factor as well. And often we don't know that we have an AV malformation or a berry aneurysm. We think about 1% of the population has berry aneurysms. Luckily, most of them don't rupture. But of course, if it ruptures in a particular patient, then it leads to a hemorrhagic stroke.